medial collateral ligament, also known as MCL, prevent the femur from sliding medially on the tibia. Lateral collateral ligament, also known as LCL, prevent the femur from sliding laterally on the tibia. Anterior cruciate ligament, also known as ACL, prevent the femur from sliding backwards on the tibia, prevent tibia from sliding forward on the femur. Posterior cruciate ligament, PCL, prevent the femur from sliding forward on the tibia, also preventing the tibia from sliding backward on the femur. Lateral and medial C-shaped shock absorbers between the femur and the tibia.
This freaking bio test on Friday. I don't know if I'm gonna be able to do it. No, it's not that much though. It's just like my leg and oh shit.
So do you think it's torn?
Well, by the looks of your x-rays, it doesn't look like anything's broken. So what we're gonna have to do is we're gonna try some ACL tests. All right. The first test we're gonna try is called the Lockman test. What you're gonna do is you're gonna lay on your back for me. If you could just flex your knee at about a 30-degree angle. What I'm gonna do is I'm gonna apply force with my non-dominant hand. I'm a righty, okay? I'm gonna then, with my dominant hand, I'm gonna grab and we're gonna push. And see how there was no give there, so there's definitely a torn ACL there. Also, I can test, this is called the anterior drawer test, kind of like what you put your clothes in. What you're gonna do is you're gonna bend this like this. I'm gonna put my knee on her foot to apply pressure, and I'm gonna pull. Notice how her knee comes at me? She's got a torn ACL.
The use of arthroscopic surgery is very common for ACL reconstruction surgery. Arthroscopic surgery is making small incisions, which is less invasive compared to open knee surgery. Arthroscopic surgery makes it easy for the surgeon to see and work on knee structures. It's very important that rehabilitation is followed up with ACL surgery. The rehab starts the day of surgery, which then follows a 4-phase over a 6-month period. The first phase begins 2 weeks after surgery. The goal of this phase is to achieve and maintain full knee extension and to prevent the patellar tendon from shortening. Phase 2 is 2 to 6 weeks after surgery, and the goal of this phase is to achieve full range of motion with light weight. Phase 3 is 6 weeks to 4 months after surgery. The goal of phase 4 is to improve confidence in the knee with jogging and running. Phase 4 is 4 to 6 months. This is the most important phase of rehabilitation because it allows the patient to possibly return to sports with pain-free range of motion.
Okay, Jenna, by the look at your knee, there's nothing structurally wrong. I don't see any breaking. However, this is where your meniscus are. We have your lateral and your medial. I do believe that there could be a meniscus issue. The first test we'll test your lateral meniscus. It's called the McMurray test. If you could just give me your leg and internally rotate your tibia, and then what we're gonna do is we're gonna stretch it out. Did you feel a pop on the outside there? No pop, okay. What we're gonna do is we're gonna try to test the medial. What you need to do is now externally rotate. And yeah, I could feel the pop, so by doing the externally rotating the tibia, we found out that she does have a torn meniscus.
The location, pattern, and size are crucial variables in regards to surgery options for meniscus tears. Radial tears can be repaired depending on their location. However, horizontal, flap, and degenerative tears generally cannot be fixed. There are 2 surgical options, both open surgery and arthroscopic surgery. Open surgery speaks for itself by cutting the knee open, but arthroscopic surgery is done by making small incisions in the knee and inserting an arthroscope. This approach has fewer risks and leads to smaller incisions compared to open knee surgery. Because there are 2 approaches to the repairing of a meniscus tear, there are also 2 rehabilitation processes. If there is a non-surgical approach, the goal of rehab is to build the endurance of the surrounding muscles, the quadriceps, and the hamstrings. It is also key to maintain an ideal body weight and avoid activities that cause pain. If a surgical approach is taken, the goal of rehab is to balance the swelling and healing process, to immobilize the knee for up to 2 weeks after surgery, to limit motion 2 to 4 weeks after surgery, and also to include physical therapy.